Well, hi there. Warm welcome. You're watching Blueprint Explosive Exclusive and I'm Meghna Dekha. Well, viewers, it's been 5 years since the onset of the COVID-19 pandemic and China is already facing another health challenge. At least so it appears. There has been, as per several reports, a rapid outbreak of the human metapneumovirus or the hmpv. Well, reports are suggesting that respiratory illnesses have been spreading rapidly across China and it's leaving hospitals as well as crematoriums overwhelmed. Of course, we do not have verified data which is coming in from either the WHO or being confirmed by the Chinese health authorities, but there are several videos which are circulating on social media which cannot be independently verified. However, they are reports suggesting that hospitals in China are struggling to manage the crowds amidst the spike in these respiratory illnesses which are cropping up. So the concern, however, remains over hmpv, the virus which is now causing a surge in the respiratory illnesses of China. So let's tell you a bit more about what it is, what can you do, and later on in the show we are going to ask you, the viewers, to connect with some of the leading doctors, leading researchers in the field who will be able to answer your queries. So what really is the hmpv? It is a germ which has been identified as the human metapneumovirus. What does it really mean? It is significant cause of acute respiratory infections which have been found so far. It spreads through contact, through coughing and through sneezing. So how would you know if you're infected with this virus? Let's tell you about the common symptoms which are there of the virus. And there you have it on your screens. There are a couple of these common symptoms of those who are infected with hmpv. Let's tell you all about it. One of the commonest symptoms is that of cough as well as fever. Not just that, runny nose, a stuffy nose or a sore throat, all of these are also symptoms of this virus. Also, remember, many may also experience shortness of breath. Rashes may develop in some specific cases, but it is not in every case. So should you be worried? Now that's the big question. How worried should you be? Should we be alarmed or should we be alert? Doctors are suggesting it's the time when we take preventive steps, when we are alert instead of being alarmed. But who all are at risk? Who all need to take extra care? Well, children aged 5 years or younger are going to be most susceptible, so beware there. Prevalent amongst elderly individuals as well. People with weakened immunity are also those who are likely to be at risk. In fact, those undergoing any chemotherapy, recipients of any organ transplants also must be very careful, especially in this winter season. However, the authorities in India have said there's nothing to worry about. All is well so far. Watch this.
मेटान्यूमोवायरस एक नॉर्मल रेस्पिरेटरी वायरस है जो जुकाम जैसे बीमारी करता है या कुछ लोगों में फ्लू जैसे सिम्टम्स हो सकते हैं, खासकर जो बहुत बूढ़े लोग हैं या बहुत 1 साल से कम उम्र के बच्चे हैं। लेकिन ऐसी कोई सीरियस बीमारी नहीं है जिससे चिंता करने की ज़रूरत है। इन दिनों, सर्दी के दिनों में रेस्पिरेटरी वायरस इन्फेक्शंस होते हैं और हमारे हॉस्पिटल्स और इंस्टीट्यूशंस इनको हैंडल करने के लिए तैयार हैं। बेड्स की भी अवेलेबिलिटी है, ऑक्सीजन वगैरह की भी अवेलेबिलिटी है। स्पेसिफिकली दवाइयाँ चाहिए नहीं होती बिकॉज इसके अगेंस्ट कोई स्पेसिफिक एंटीवायरल ड्रग्स है नहीं। जहाँ तक कि हमारे यहाँ का डेटा का सवाल है, कोई ऐसा बहुत ज़्यादा केसेस नहीं आ रहे हैं, ना तो हमारे हॉस्पिटल्स में, ना ही हमारे डेटा में जो IDSP पे आता है, जो ICMR का डेटा है, उसके हिसाब से नॉर्मल इंक्रीज जो सर्दियों में होता है वही है, उससे ज़्यादा सीरियस कुछ नहीं है। तो चिंता करने की आवश्यकता देश को नहीं है इस वक्त।
So let's go across to our panelists. Today joining us are two noted doctors who will be taking questions from you, the viewers. If you have any questions, you can simply pick up your phones and give us a call at the numbers there flashing at the bottom of your screen. We have Dr. Amitav Banerjee who's joining us. He's an epidemiologist and also a professor emeritus. Also, we have from the DY Patil Medical Hospital in Pune. We are also joined by Arjun Khanna. He's a pulmonologist, a senior consultant at the Amrita Hospital. So let me first go across to Dr. Banerjee. It's important for us to understand. We were looking at the symptoms here. The reason why many people are very worried is that the symptoms seem to be so common. How do we know if it is a new virus, if it is an older virus, if it is something that we should be worried about, or if it's just a regular flu? How worried should we be if we catch a cold?
Oh, thank you, Meghna. One thing is certain, it is not a new virus. It's not a novel virus. It was first identified somewhere in 2001.
2001,
in
yes.
Holland. And if it has been identified so far back, I don't see that it may not be prevalent in our country also, because 20 years is a pretty long time. And respiratory illnesses are very common in children. In fact, in India, under 5 mortality from respiratory viruses, every day we lose more than 2,400 children every day in India from respiratory viruses. So just by giving a name to a new virus, we should not cause panic, unnecessary panic. Because giving a name if we start identifying, and if your media reports that every day 2,000 plus children are dying of respiratory viruses, we can generate panic from this end of the world also. And similarly, all viruses are pretty harsh on extremes of age, like children and of course the very elderly. Those who are bedridden, any virus. So it's nothing very specific about this virus. And our problem is that we are highly vulnerable because we have the highest rate of under 5 malnutrition. So as it is under 5 malnutrition, it will cause immunocompromise. It will compromise the immunity.
The immune system.
We should take care of these things. We are not going to wait for the virus from coming across the border. It is already within our borders.
Okay.
So that I don't think we are to really be extra alert. But we really take care of our general health services, and the health centers should be well manned, peripheral health centers, because there is crowding. I was seeing the pictures from China. There's so many crowding in hospitals. There are so respiratory viruses will spread. Even people with a sneeze will rush to the hospital.
Absolutely.
So we should triage only serious patients are not cared for.
Yes,
so
you've made very relevant points that we should be prepared for it. There is nothing new and very novel about it, but anyways, these are viruses which have been existent, and children are anyways more vulnerable. So primary health services are important and precautions need to be taken instead of being alarmed over the situation. I'll just come to you, Dr. Banerjee, later, as well as Dr. Khanna, but there are lots of viewers who are calling in with their questions. We have Jayanti, who's calling us from Madurai. We have Dwarkanath, one of the viewers calling us from Coimbatore. Jayanti, go ahead. What's your question?
Yeah, hello, ma'am. I have 3 questions. Number 1, me and my husband both are 60 plus, and we have taken the corona vaccination also,
Right.
boosters also. So now my husband having taken some breathing problems, so he's taken some medicine. So now, what are we have to do or going to do?
Okay, so Dr. Khanna, what are your suggestions for the elderly, for the senior citizens? What should they do? Dr. Khanna, you're muted. If you could just unmute yourself, please.
All right. So as Sir said, the first thing to do is not to panic, right? And the lady who asked the question, they've already been vaccinated against COVID. So the COVID vaccine is not going to be effective against this particular virus, right? So if you are at risk, if you are elderly, if you have any cause of compromise, immunocompromise, you need to stay inside. You know, it's the feeling of deja vu, back to the COVID days. But just wash your hands, use a hand sanitizer, wear a mask, avoid public places, the general precautions. Human metapneumovirus is nothing new. We've been having it for years together. Please do not push the panic button. Let's not sensationalize this. Let's be sensible about it, right? That's all we need. There's no special precaution that we need. Just precautions of general hygiene. Don't, till the time we know how this is going to settle for the next few days, just be cautious. That's about it.
Just be cautious, ensure that you are following the protocols that we know so well. Mask up, avoid crowded places, avoid places which may not be unhygienic, and hand sanitizers, just the basic precautions that we are all aware of already. Now, Dr. Banerjee, one of the things which is interesting, you're absolutely right. In 2001, this virus was already detected. What we are trying to understand here is that it is something in United States, at least, we've seen the trend that it is more active during the winter months and during the spring. So should we in India as well be more vigilant during this time? Does it come with some kind of a time frame?
Yeah, definitely, because we have the less humidity and the cold air, the epithelial is vulnerable. All viruses, I mean, it's not specific for this particular virus. So all respiratory infections show a surge during the winter months. So that's all. I mean, we should not really create, as you say, medical stampede. And overall, general health is important because basically lower immunity goes with low nutrition. Elderly also avoid their diet, and particularly sunshine. In winter, if they stay indoors, they may require some vitamin D supplementation also, because that has been associated with some immunodeficiency. Another thing I feel is that, of course, all these many viruses are flaring up post-COVID, particularly in children. So, of course, it's a very nebulous idea of immune debt. Like children grow up, their immune system gets trained by exposure to virus. They recover and they develop.
Okay.
So because perhaps very harsh measures like quarantine, lockdown, particularly in young healthy children, their immune system has not been trained enough. I mean, this is a thing which is a hypothesis. It has been challenged also. But this, as we know, children, they grow up, because we cannot keep running after and chasing each and every. There are thousands of viruses, many may be undetected also.
Absolutely.
So respiratory system is full of viruses. Any pathogens can be isolated, and in a healthy person, healthy child grows up, the immune system gets trained, and we are able to cope up with it. But of course, we should be careful. I would rather say that we should be careful with child malnutrition, which is very high.
That is a big concern.
And elderly malnutrition.
Elderly malnutrition, child malnutrition, these are big concerns because it directly impacts your immunity, will impact how much and to what extent you can fight back this virus in layman's terms. In fact, let me go across to one of our viewers, Pradeep, one of our viewers calling us from Visakhapatnam. Go ahead, Pradeep. We'd request all our viewers to please put your television sets on mute. We'll be able to hear you better. You'll be able to hear us better as well. Go ahead, Pradeep.
Can you hear me right?
Yes, we can hear you now.
So, I just wanted to understand, is it similar to COVID or is it a different kind of virus?
How different is it from COVID, Dr. Khanna?
So it belongs to a different family, but all respiratory viruses would start as a similar illness. You know, the illness is actually going to be similar. It is going to start with the upper respiratory tract infection, which is cough, coryza, a running nose, some amount of cough. But whatever data we have right now, metapneumovirus usually affects children who are less than 12 years of age. It is more like a self-limiting illness. You know, you'll have fever, you'll feel lethargic, you'll feel miserable for the next 2-3 days, but that's about it. So it's you know, based on the clinical features, you cannot really distinguish it from other viruses. Influenza, early COVID-like illness, other respiratory syncytial virus, which is the most common cause of, you know, similar illnesses in children.
Right.
All of them would come with similar kind of a clinical picture. So you really can't distinguish between any of them clinically, and you need not do that, right? Because the treatment does not differ. The treatment for almost 99% of all viral illnesses is symptomatic. You take care of the fever with paracetamol, you hydrate the patient, you isolate yourselves, and in more than 90%, 95% of the patients, you're done. You don't need to,
You don't need hospitalization in that, just to make it clear.
Not at all.
Okay.
Not at all.
Okay, so there you have it. The two doctors have given good advice. Be alert, don't be alarmed. Nothing to panic right now, just take the precautions. Because if we put our focus on the primary health clinics, if we make sure that we are taking the precautions, this is not a deadly virus per se. Hospitalizations are very rare, 90%. As the doctor has said, 90% of them can just be cured. We can take care of the symptoms and can be cured at home. So no need to panic. Thank you so much. I appreciate it a lot, Dr. Banerjee as well as Dr. Khanna for joining us here on the show. Hopefully, we've managed to clear some of the rumors which have been doing the round. It's important that we are alert, not alarmed. That's the message we'd like to go out from here. Thank you so much, all the viewers, for calling in as well. Without a short break.